Hello friends, have you ever heard this term called eating epilepsy? Eating epilepsy means when you take something or when your friends is in the middle of a lunch, suddenly he gets confused, suddenly he looks, he stares somewhere, there's a drooling of saliva and he just mumbles or does some chewing automatism, the food falls from his hand, he might fall or get a generalized seizure. This is called a eating epilepsy. It's not that uncommon. It occurs in around 2 to 6% of the population, those with epilepsy. So this can manifest in various ways. This may be a simple partial, just a jerks only. Sometimes there can be additional confusion along with the jerks. Sometimes there can be a fall or a fit. So differing manifestation with the differing symptomatology. Sometimes there can be a lesion in the brain, in the temporal region or in the extratemporal region, but usually brain imaging or the MRI will be normal, but the EEG can be abnormal, and the history is so typical that whenever the particular person takes some food, maybe this may be rice, this may be non-vegetarian food, this may be fried food, this may be something sweet one, anything, any combination or anything can precipitate a pre-eating epilepsy. For that particular patient, that particular food may be the precipitant. So you have to find out which food precipitate the eating epilepsy. This is something like a reflex epilepsy. I think you must have heard reflex epilepsy. Suddenly you hear some noise, you get a fit. Suddenly somebody touches you, you fall down and get a fit. Suddenly you see you are playing chess, you are reading a book, you are doing an arithmetic, you are watching the television, or you are thinking, or pouring hot water on your head, or any other stimuli, say flickering stimuli, the stimuli in the disco bar, many factors. This would precipitate a fit. It's called a reflex epilepsy. Eating is one such reflexogenic epilepsy. So as I've mentioned, the history is most important. You have to have a EEG to electroencephalogram, a MRI brain and other tests, and you have to continue medication for epilepsy. Maybe different types of anti-epileptic medications are available. Then when you do the EEG, the person should take that particular food which would invoke a fit, like if rice is the culprit, you give him the rice and do the EEG. Sometimes this can precipitate a fit akin to the one which he used to get it. Secondly, you try to have some behavioral modification, like if you are hungry, don't take the food as a whole. So always try to have a regular interval small feeds. Don't take a big bite, take a small bites, and better to avoid you're concentrating exclusively to the food. Always you can talk with your friend, you can look outside, and don't concentrate on the food, because the food is the most important thing for all the species, because when you get the food, you will so many stimuli get into your brain. Is taste, your smell, is sight and memory, and various taste stimuli, sensory stimuli, olfactory stimuli, hearing your various sounds of the food making. So many precipitants, the touch, everything is contributed to that particular pathogenesis of the eating epilepsy. So the important message is that whenever somebody is getting some abnormal phenomena, confusion or fall while taking food, you have to evaluate whether this could be a eating epilepsy. Do an EEG, do a scan, take the anti-epileptic medication and do some behavioral modification. Don't take food en masse, take small quantities, frequent interval, don't have a big bite, and you should divert your attention from the food while taking food. Maybe you can use a glass, or you can have a different preparation of the food, or if some food is precipitating a fit, always avoid that food, and instead of frying you can have other curry or something. So that is how you try to have a different way of eating or different way of cooking food. So that's all I want to tell you, that eating epilepsy is quite a curious phenomenon. It can be largely treatable, So let me conclude here by telling you that you can always have your opinion in the comment box. Thank you very much. Bye.